Thank you, Joseph, for joining us today. Could you tell me a little bit more about your trial, please?
So the GAPS trial, which is the graduated compression as an adjunct to pharmacothromboprophylaxis in surgery, or the GAPS trial, was a large randomized controlled trial. It's actually the work of a very large team who worked very hard over a number of years to deliver this trial. And that includes the chief investigator, Professor Alan Davis at Imperial, a trial management team with an excellent trial manager, and a statistical team based at Edinburgh and Aberdeen. There was also 7 trial centres with principal investigators and trial nurses based at each of those centres. So it was a very large team that were involved in delivery and analysis of this study.
And what were the objectives of the trial?
So thromboprophylaxis and preventing blood clots and venous thromboembolism is extremely important. And there's been a large body of evidence looking at whether blood thinners, thromboprophylactic agents, reduce blood clots in patients who are having surgery. And we know that they tend to. Also, there's been some evidence looking at graduated compression stockings and whether they reduce blood clots in surgery, and they also appear to. But what hasn't been studied is whether, if a patient is receiving thromboprophylaxis by chemical form, so with low molecular weight and heparin injections, whether adding compression hosiery actually gives you an additional benefit in those patients. So it was to look to see whether in patients who were having thromboprophylaxis, whether you needed to use stockings as well. It's important to understand that the population which was included in this study, so it was surgical patients and it was elective surgical patients, patients having planned surgery. So it didn't include medical patients, and it didn't include patients having emergency surgery, and it didn't include patients who had admitted who did not have a surgical procedure. Of those patients, there is also a subdivision. So everyone who is admitted for surgery in the UK is subject to a VTE assessment. And that VTE assessment categorizes them into low, medium, and high risk. And these patients all had a VTE assessment, and these patients were the medium and high risk group. And those were the patients who would be receiving chemical prophylaxis with low molecular weight heparin. And that's why they were selected. They would also ordinarily receive graduated compression stockings, but in this randomized controlled trial, they were randomized 1-to-1 by a computer to either receive what was standard of care, which was the combination of the injection and the stockings, or just the injection and no stockings throughout the duration of their admission. Importantly, there was a group of patients that were excluded, and they were the patients who ordinarily would receive extended prophylaxis, i.e. prophylaxis beyond their hospital admission, orthopedic and cancer patients who require an extension of their thromboprophylaxis beyond their hospital admission into their post-discharge time at home.
Thank you. And in setting it up, what design did the trial take?
So the trial was an open, multi-center, randomized controlled trial. That was that the patients knew which arm they were going to be in, either they knew whether they were receiving stockings or not. We did not have a placebo stocking arm for a number of reasons. Another important aspect of the study design was that it was a non-inferiority design. And what that means is that we were not looking for one arm of the study to be better than the other. What we needed to show was that the patients who were not receiving the stockings didn't do worse than the other group.
And when you set it up, what settings did the trial take place in?
So the study was based in 7 NHS centres who were offering surgical interventions across the UK.
How many participants were there in your complete trial?
So there was 1,905 patients who were randomized. They were all elective surgical patients who were risk assessed as being at either moderate or high risk of venous thromboembolism. They were all adults over 18 years of age who consented to participate.
How did you approach intervention in the trial?
So as I mentioned, the 1,905 patients were randomized by a computer on a one-to-one basis to receive either the combination of prophylactic dose low molecular weight heparin injections during their time in hospital, plus stockings during their time in hospital, or to receive the injections during their time in hospital, but no stockings.
Thank you. Having carried out the trial, what were the outcome measures?
Type up to 90 days. And how we measured this was a combination of symptomatic or asymptomatic DVT, and this is quite important. So if a patient had symptoms of a DVT, they would get a scan at any time up to 90 days. And if they had a DVT on that basis, they would be included as having received a primary outcome. Also, we electively scanned all patients upon discharge at a single time point between 14 and 21 days. So all of those patients had a scan, and we also included those patients who had a scan but were asymptomatic within the primary endpoint. And finally, if patients had shortness of breath or chest pain consistent with pulmonary embolism, and they had a scan which proved a pulmonary embolism, then they were also included. So it was imaging proven, symptomatic or asymptomatic DVT, and imaging proven symptomatic pulmonary embolism up to 90 days.
Thank you. What were the results that the trial found?
So of the 1,905 patients that were randomized into the trial, 1,858 of those participants were eligible for analysis. There were 17 patients were identified as ineligible after the randomization, and 30 patients, even though they were randomized, for some reason their surgery didn't go ahead or was cancelled, and therefore they could not be included in the analysis. In terms of the primary outcome, which was symptomatic DVT, asymptomatic DVT, or symptomatic pulmonary embolism up to 90 days, of the patients who received the low molecular weight heparin alone, 16 out of those patients, which was 1.7%, had the primary outcome. And of the patients who received the combination, 13, which was 1.4%, had the primary outcome. And in the analysis, which was a non-inferiority analysis, this was not statistically significant, and therefore there was no significant difference between the groups based on the non-inferiority analysis.
So overall, what conclusion do you draw from the graduated compression stockings GAP study?
So based on this trial, which was the first of its type, in this patient population, namely elective surgical patients who are risk assessed as being at moderate or high risk of venous thromboembolism, but not requiring extended prophylaxis beyond their inpatient hospital stay, there was no significant difference between the patients who received the combination of prophylactic low molecular weight heparin and graduated compression stockings during their inpatient stay compared to the groups that just received the prophylactic low molecular weight heparin during their inpatient stay. And therefore the interpretation of this is that in this specific patient group that the graduated compression stockings are not required.
Thank you very much, Joseph. That's really helpful and informative. Thank you.
My pleasure. In terms of dissemination of this information, we're looking to see which centres are changing practice on this basis, and I think it's very important. Based on health economic analysis, more than £60 million per year are spent on graduated compression stockings in this population every year in England alone, and this is on a recurring basis. And therefore, if we were able to remove these unnecessary stockings, then that money could be spent elsewhere, also on VTE prevention, to ensure that the efficiency of our use of NHS funds on VT prevention was maximised.
And if anybody wanted to contact you to discuss or implementation of this further, or areas of the trial, how can they do that, please?
So they can contact me on the email address, and this email address will accompany the video.
Thank you very much.
My pleasure. Thank you.